Good evening. I'm Kelly Callahan, Director of the Carter Center's Trachoma Control Program. I'm delighted to welcome you to Conversations at the Carter Center. The Conversation series gives us an opportunity to discuss important issues with you, our friends and supporters, and through our webcast with our friends around the world. Tonight, we are especially honored to have Ambassador Circles and Legacy Circle members and guests here in our audience. Without your support, we could not do the important work that we do to improve health, support human rights, and deepen democracy around the world. Tonight is the last Conversations event of the 2014-2015 series. Please check our website in July to learn about the new lineup planned for this fall. We will kick off the next season with a special conversation in September that features President and Mrs. Carter. Please note, for the last 15 minutes of the program tonight, we will invite members of the audience who have questions to come to the microphones to ask questions. And now it's my pleasure to introduce my co-host this evening. Mr. Jim Ervin was president of the International Association of Lions Club from 1999 to 2000 and served as chairperson of the Lions Club International Foundation from 2000 to 2001. He has held many other positions within the association, including international director during 1992 to 1994. The Lions Club International Foundation has been a key supporter of the center's efforts to fight river blindness and trachoma for more than 2 decades. Since 1999, our 2 organizations have collaborated to eliminate blinding trachoma in Ethiopia, Mali, Sudan, Niger, and recently, Uganda. Past President Ervin has personally traveled to see our groundbreaking work in places like Amhara, Ethiopia, one of the most trachoma endemic regions in the world. Given the generous support of the Lions Club and past President Ervin's firsthand knowledge of our trachoma work, we are extremely grateful to have his perspective here tonight. Before we begin our discussion, I'd like to show you a brief video trailer from a new documentary on the Carter Center's trachoma work that will air early next year. This short trailer demonstrates how partners and community can work together with proven and cost-effective strategies to prevent and control blinding trachoma. Please join me in watching.
I love being on a drive in a rural part of Ethiopia. You have a destination in mind and you take a turn, but it opens into a new vista, one that you didn't expect. And you take the next turn and it's urban, and the next turn and it's a green space opens up. You just never know what's around the next turn.
Today is Saturday and we are driving to a marketplace.
So they're all having to walk 2, maybe 3 hours
Yes.
to come to the market. This is Amhara, Ethiopia. 20 million people live in Amhara, and 1/4 of the population is susceptible to this blinding disease caused by a bacterial infection called Chlamydia trachomatis. Trachoma is the leading cause of preventable blindness in the world, and this is the heart of it. It is transmitted through a fly. This fly breeds on human feces. What happens is someone that has chlamydia trachomatis has discharge out of their eyes and their nose. So this eye-seeking fly lands on this discharge and then takes that on its feet to the next person, and then the next person, and then the next person. And what happens is, if my body's a barometer of Chlamydia trachomatis, when I get to about here, my eyelid starts to turn in. My eyelashes start to scrape my eye. So my eyelashes start to scrape my cornea. And when that starts to happen, it's painful. So I want to pull my eyelashes out.
This is a local remedy. It's an epilation tool.
So I get a tweezer, something, and I pull my eyelashes out. Well, when those new eyelashes start growing back in, they start to scrape the cornea again. And as it scrapes the cornea over time, the person eventually becomes blind.
Trachoma traditionally affects the people at the end of the road. They're the forgotten people. They are people with very little political voice. Because trachoma is a hidden disease, it's very difficult for people to care. Well, we do care. And we want to reach all of those people.
The Carter Center is different. We work in collaboration with the Ministry of Health.
We are using the government structure.
We will mobilize, the people. We'll surround, all the town.
ትማራላችሁ፣ ትዝናናላችሁ፣ አውቃችሁም ራሳችሁንና ቤተሰባችሁን ከትራኮማ በሽታ ትከላከላላችሁ።
We have seen, the impact of health education.
በመጀመሪያ እኔ ፍሬው ደመቀ እባላለሁ። የመጣሁት ከካርተር ሴንተር ኢትዮጵያ ነው። እንግዲህ እንደነገርኳችሁ ይህንን ይመስላል። እስቲ ትራኮማ በሽታን ለመከላከል የሚያስችሉ እነዚህ አራት ፊደሎች ምን የሚሆኑ ናቸው?
The SAFE strategy is a strategy that's built on 4 pillars: surgery, antibiotic, face washing, and environmental improvement. So this is a community latrine just off the side of the road so that when people come to the market, they have a place to defecate. This is all a community effort.
When the community is committed, anything is able. Everything you see here is collected from the nearby village.
They purchase nothing.
Nothing.
So they're using their time, their energy, and resources that are easily available. I'm going in.
Good luck.
All these bags that make up the wall are from their own sacks. And every piece of wood in here, every stick has come from the community. So this is really nice. I don't see flies on the children's faces. I don't see flies on the adults' faces. See, look at how beautiful her face is. Her eyes, no trichiasis. Beautiful. You know, in my culture, they say the eyes are the window to the soul.
Assalamu alaikum. Saying that after the treatment, I'm quite healthy, I can take care of myself, and I'm leading a very happy life.
Alhamdulillah. Alhamdulillah. See, this is why we do what we do. This is the SAFE strategy in action. Surgery to take care of everyone that has had trichiasis. Antibiotics to reduce the disease burden. Pfizer agreed to donate this drug. Face washing so the fly has nothing to feed on the eyes and the nose. And latrines so the fly has no place to breathe.
This is very practical demonstration of how it is possible to get rid of fly population, and by doing that, rid of trachoma.
The first time I saw the video, the trailer, I was moved. It documents the work that we do in the field to such a degree that you can see the safe strategy, surgery, antibiotics, facial cleanliness, and environmental improvement. You can see it working. And in 7 minutes, I got to see the very beginning all the way to the end. And as we all can see in a very short period of time, the safe strategy works. The Carter Center has been doing this in partnership with others in terms of trachoma and eliminating blinding trachoma since 1999. And I think it's really poignant to see the Lions Club, the actual logo on the truck that's delivering health education and on a shirt, and to actually see that the Lions aren't just there in spirit, the Lions are there and physically go there quite often. So I wanted to start the conversation and, reflecting upon the video that we just watched. And Jim, you've been to Ethiopia 5 times, and all in with working with the Carter Center and looking at the trachoma control program. And maybe you can give us your perspective on what you've seen.
Kelly, it's just a small part when you look at this and think about what a large country and a beautiful country that Ethiopia is. And to know that there's such a scourge on those children and people there that have been going on for hundreds of years. And many of them felt that it was only natural for them to go blind. They had no idea that what they had was preventable or reversible. And on my first trip, I had an opportunity to meet with the president of Ethiopia, and I shared with him the partnership that we had created and what we were doing with the Carter Center, and that we wanted the government to help us and work in partnership with us toward reducing blinding trachoma. And the first thing he said to me was, we would love to be able to do everything with you, but we don't even have an economy. We live off of the World, USAID, and other organizations, so we don't have a means of really helping our own people. And then on my next visit there, when we spent more than 10 days all around Amhara, out in the bush, going from the top of the mountain and seeing how those people lived, down into those villages, and seeing all of those children that were infected with the trachoma and how they were spreading it. But what I want you to think about tonight, you saw those pictures. All of you here are either parents or grandparents or going to be. And there's nothing that you love more than to pick up that baby and hold that baby and let them touch your face. Well, that's how part of this infection gets spread, because they love those kids just like you love yours. And so what you're doing and what we're doing together is very, very important. And I know that in all of those trips, each one had a different meaning or different things were taking place. And of course, when we were there at the 10th anniversary, and some of the Dr. Frieda Hall and some of the vice presidents from Pfizer went with us, and I believe that that was their first time being in Ethiopia and seeing what was taking place, and especially the benefit from the Zithromax that they were providing. And I think they were extremely excited and appreciative of what it was doing. And of course, Sharon, it was her first trip, and she just couldn't believe what was being done, but more importantly, how great the need still is.
And Sharon's your wife.
Yeah, Sharon's my wife.
She was able to go on that trip with you as well. So over those 5 trips that you've taken, in 2000, we started in 17 districts in the Amhara region. And now we're in all 167 districts of the Amhara region. So you've seen this growth and this scale up over time. And given the logistics, I mean, can you even imagine that we could have gotten to this stage, given what the president said then, and now you look at the success that we've seen so far?
You know, when we first went in, and some of the things that you learn is, in our country, in our towns and cities, we call them mayors. Well, the village chief, in most cases, has to approve anything that's done. And if that chief doesn't believe that what you're trying to do to help those people is the right thing to do, they don't let you do it. So teaching them and teaching the health workers to teach them was one of the first things that we had to overcome. And of course, when you look at the beginning and where we are today, it's amazing because they are truly trying to help themselves.
And there was a remark in the video that the Carter Center is different. We work with the Ministry of Health. We're also community-based and oriented. And we work with the Health Development Army and the health extension workers in the context of Amhara and Ethiopia. So we have scaled that program massively to size. So in the beginning, in 17 districts, we were only talking about maybe 200 or 300 or 400 people. And now we're talking about 38,000, 40,000 people and mobilizing them in massive campaigns. So given that, and given your 5 visits and the remarkable achievements to date, what's one of your favorite memories?
Well, after my first visit there with the president of the country, I went back on another visit, and there was an area that had been a blind school. And it had gotten to where it was dilapidated and the government was no longer able to continue to keep it up. And of course, you saw how important the water is. And so the Lions of Ethiopia had decided that they were going to help to rebuild this school for the blind people there and help to train them in various ways. And so when I go back for that visit and they're putting in a water well, and the Dr. Tabebi, who's a Lion and helps head up a lot of the programs for the Lions, said to me, "I have a surprise for you." And the surprise was when I walked up there, the person that headed the project was the former president of Ethiopia, and he had become a Lion.
That's an amazing story. That's just amazing. The Lions are a formidable force in terms of partnership and exciting someone about service and partnership. So maybe you could give us a little bit of background about the Lions Carter Center Site First initiative and how that started.
Well, in 1988, the World Health Organization said to our Lion leaders that there were some 40 million people in the world that were blind, and 80% was preventable or reversible. And that if something wasn't done, within 20 years, those numbers would be doubled. So our board at that time voted to begin what was known as the Site First program. And we raised funds through the Lions organization, $146 million from Lions, to begin this program. And then in 1996, the Lions of Georgia had put forth President Carter's name to receive the humanitarian award from Lions Clubs International. He was selected by the president and the trustees of the foundation, and of course that happened in Montreal, and he came to receive that award, and with it, of course, was a $250,000 check from the foundation to the Carter Center. That was the same year that I was elected as the international third vice president of Lions. And at that meeting, we began to talk a little bit about maybe what we could do together, because the Carter Center had just prior to that taken over the River Blindness Foundation and was beginning to start their work with the river blindness. So as we began to talk, we set up a meeting, and President Carter and members of staff, along with our executive officers, met in Chicago. And we put together a couple of pilot programs in 1996 that began later, and that was the beginning of our work together. And in 1999, when I became the international president, we had a board meeting here in Atlanta and at the Carter Center, and that's when we made a major commitment and a major partnership together, and we committed at that time $15 million, and that's how we began our work in, of course, onchocerciasis, and then later in trachoma. And it's been a fabulous partnership, and we've just been extremely proud of of not only the partnership, but of the successes that we've been able to share.
It's really fantastic. And another long-standing partner of the Carter Centers, and with this, has been Pfizer. And I know that you went to Pfizer in New York City in 2000 with President Carter to have a conversation there and thank them for the donation that they committed to making. So maybe you could talk a little bit about that and how the team there, the employees, received you.
Kelly, after I had been to Ethiopia and seen a lot more, we had also been at that time going back and forth to Geneva with the meetings with Vision 2020, and the Carter Center had joined with us, and we knew what the International Trachoma Initiative was doing. But I said to President Carter and Dr. Hardman at the time, I just feel like that if we can get Pfizer to help us with the Zithromax, that maybe we can move faster and do more. And I knew that they weren't going to give me a meeting, but I was certain that if President Carter asked for the meeting, that we could get it. And so it did happen. And when we went there, of course, Mr. Steer was the chairman, and Mr. McKinnell was there. And so as we began to talk, there was some conversation about a need that Pfizer had in South Africa as it related to the HIV/AIDS virus. And so the president shared with them that there were certain countries that the Carter Center was already working in, and that it was endemic in those areas, and that he felt certain that they could begin the distribution of that medication. And then Mandela would see that it was needed in South Africa. And then from that, we shared what we wanted to do in partnership with the Lions and the Carter Center, and said that we would be very honored if they would consider letting us have the Zithromax for the work that we would do in Mali and Ethiopia and Uganda and Sudan. And so Mr. Steer's comment was, it's a done deal. And that was the beginning of what you see today. And I can tell you, if any of you know anybody from Pfizer, and I know we have some of them here today, show your appreciation and thank them for what they're doing, because the value of it is tremendous. It's probably now over $2 billion, but the good that it's doing, they're a great corporation and a great sponsor, and I hope that all of you will say thanks to Pfizer for what they're doing.
So when you heard it's a done deal, were you just elated?
Oh, I was happy. I'm telling you, that was a great day.
Yeah, I bet it was. And President Carter was there, and you're all there, and it's a done deal.
It's a done deal. And then we went over to the factory where some of the medication was being made. And their employees were there, and they were hanging from the rafters. And I mean, it was amazing to see. But they wanted to hear President Carter, and he shared with them the value of what they meant as an employee of Pfizer, and what the medication that they were making and how it was changing human lives.
It's a fantastic story. Yeah. There's been several studies that have been done that a single dose of Zithromax can improve the outcomes of childhood mortality, that children will not die based upon the byproduct of this. So the Trachoma Control Program, in its efforts to eliminate blinding trachoma, has byproducts as well as part of its success story. So it's just really amazing. And when we talk about success, you know, we talk about a single person not going blind by this horrendous disease. And at this stage in time, since 1999 to 2014, we've been able to collectively distribute the Carter Center and the Lions Carter Center Site First Initiative with Pfizer. 113 million doses of Zithromax have been distributed so far. It's just an amazing feat. Also, 477,000 surgeries to turn the eyelids have been done. We've also been present in over 12,300 villages delivering health education. Over 3.1 million latrines have been constructed. These are just amazing numbers in a very short period of time, 16 years. We've also assisted Ghana in eliminating blinding trachoma, and 2 states in Nigeria, and Mali and Niger and Sudan are on very fast pace to have some excellent news over the course of the next couple of years. So when we talk about success, you know, it's those numbers that are amazing, and that one individual is not going blind, and then that's multiplied out by so many people, particularly in Amhara, where it's just a disease that's entrenched in the population. And then you have the byproducts of success. You have latrines, where women are no longer stigmatized for defecating in the open bush, where they feel safe, and that it raises their status. You have byproducts in a country's gross national product. I mean, Ethiopia, if people are not going blind and they can farm, things change. An entire nation can change. And also, it's something to be proud of. The Lions Carter Center Site First Initiative is the largest MDA, mass drug administration, in the world that's been done at this point in time at scale. So there's proven strategies that have been extremely successful. And you know, I can grab little pieces of success, like the woman in the video who had trichiasis surgery on both of her eyes and was not going to go blind from this disease. And I immediately start crying. Yeah. I get very emotional, especially with something like that. A woman sitting in front of me thanking me that she's not going to go blind. And it's hard to have a favorite success as part of this big story. But if you had one...
Sally, you know, when we went for the 10th anniversary, and Sharon and I were, along with the other people, were going through some of the villages. And we went into this one family's home, and this lady was so proud. She wanted to show us her house. She wanted us to go inside because they no longer had the animal, the calf, living inside the house with them. They had built a separate area outside, and then she took us around and showed us the latrine that had dug outside her house. And I can tell you, she was more proud of that than if she had a new Mercedes. It was really something. But that's what you're doing. You know, we, in this country, we talk about quality of life. You know, we say, well, we're going to work on our quality program, and we get a new house or a new car or a new boat, and we feel like we're doing something. But if you think about those countries, and what you saw is an improved quality of life for millions of people, is to not only save their sight, but in many cases, to have one good glass of drinking water every day. Now that's an improved quality of life.
Absolutely. And one of the things that the video, the trailer, the 60-minute video will talk more about is the lack of water and how difficult it is for people to get 2 or 3 handfuls of water to keep their children's faces cleaned and for their own facial cleanliness every day. So as part of this story of success,
well, in one of the at the same trip, we were going into some of the schools, and at first it was very difficult to get the schools to accept the SAFE program. But once they understood what it was all about, the teenagers in the school created a play about the SAFE strategy. And they would put that on for the smaller kids. And they took on the responsibility to make sure if they had a sibling, a younger brother or sister, that every day before they left, whether they were going to school or whatever, is that their face was washed and that they were clean. And then they had put, where they had built their latrine, they took a bucket about the size of a paint bucket, and they put little pinholes in it and filled it with water, and when they came out of the latrine, that's the way they washed their hands and their face. So it was the beginning of them getting to understand how important face washing was for them.
It's been a revolution. I mean, you know, the video that we showed had, the children had lots of flies on their faces, and there are still. I mean, we'll talk about challenges. There are still lots of flies and lots of children with faces that have flies on them. But as a progressive success story, There has been more water points. There are more people that are changing their behavior. They're using these tippy taps, as they're called, and people are washing faces, so we see less flies on the faces. So it's been a huge success and really a cultural behavioral change story.
Well, it has, and we're proud of the successes that we've had, but it's just the tip of the iceberg. We have so much more to do, and we must continue. And that's why all of you as supporters of the Carter Center, that's why you're very important in this process. We need you to help us help others.
So in terms of that, Jim, let's talk about challenges. You know, there's lots of challenges in terms of civil conflict, such as South Sudan and accessing areas there. Some places are hard to reach as well. In Mali and Niger, we have challenges there. And then sustaining these marked impact points that we've had in terms of facial cleanliness and latrine use. Access to water is an issue. Rebuilding these latrines is also an issue. And funding, attracting more partners, raising awareness globally. There's been a great upsurge in the global trachoma program. There's a great need and proven cost-effective strategies. But you know, again, there are incredible challenges. Can you pinpoint or poll a challenge that you see as one of the greatest that needs to be overcome?
Well, the greatest right now, I think, is the F&E, is the continuous work on teaching them, of getting them the water, of getting them to understand how important that is, and as well as the latrines. And when you look at the millions of people that are there and you hear the numbers, you think it's big, but it's not. It's just a very small amount compared to the size of the country and the needs and what's left to be done. So we got a lot of work ahead of us.
And Ambassador Peters, in her opening remarks this evening, talked about those that are at risk. 232 million people globally are at risk of blinding trachoma. And we have 5 years. The goal is to eliminate blinding trachoma by 2020. So we have great odds ahead of us. And if there was anything that you could do, if you had a magic wand and you couldn't just take away trachoma like that, but if you had a magic wand and you could do one thing right now for those 232 million or those 20 million even in Amhara, where you've been several times, what would that one thing be that could be a quick, immediate fix?
Well, I think if I had the higher power from upstairs, I think first thing I would say that I would hope that, and I know everybody has different beliefs and religions, but I would hope that God would continue to give us the strength to serve and the courage to care. Because right now we need more people. We need, if we could get corporate America, not just Pfizer and some of the pharmaceuticals, but all these people that are making big money, to realize that there's a great need for humankind around the world. And many of you all work for these corporations and may have some influence on them. But if I could do that, I'd say, Lord, please bring us more people to help us. We're proud of what we've done, but we need more people to make this thing, to eliminate the backlog of preventable and reversible blindness.
And that segues us lovely into the future, and our partnership with the Lions is so important, and Pfizer, the Hilton Foundation, and all of our individual donors that are staying the course with us, and we need to stay the course. We need to work harder. We only have 5 more years. So in terms of that, there's still quite a bit that needs to be done.
From our commitment, you know, after the 99 meeting here, each year we got our international president and officers to come here to visit with President and Mrs. Carter so that they could see their commitment to our partnership as well as to be updated and to see how from those first days of what was being done to the numbers today. And you look at Paul Emerson and Frank Richards and the work that they've done to help contribute, it's amazing, and they've seen it grow too. And to both of you, thank you for what you've done.
I know President Carter became a lion when he left the Navy, and he was motivated by a great need to serve. And that brings me to a question I've been wanting to ask you. What motivated you to become a lion?
Well, my neighbor was a member of the Lions Club, and they used to have what they call an out-of-den every 5th Tuesday. And he'd always call me and say, Jim, why don't you come over and help me? And he had a little lake camp between our house and his house. And that's where at that time, it was all men, and they would come out and cook steaks and barbecue and have a big time. But I was always there cooking. And about 5 or 6 years later, one of the members said to Benny, Benny, when are you going to ask Jim to be a member of the Lions Club? And he said, hell, I thought I had. So that's how I got to be a member of the Lions Club in 1977.
So you thought you were a lion for
well, I felt like I was. I was doing a lot for him.
So what motivates you to serve?
Well, when you have the opportunity to be in a position I've been in, and you see the needs around the world, trachoma, river blindness, people going hungry, there's a great need, and there's never enough of us that are willing to do that. And I get excited. I always say to my Lions friends, we have shared opportunities, but we have shared responsibilities. And I think that's the same for all of us in this room. It's wonderful when you see the smile on the face, when you see that woman right there that smiled, knowing that she's not going blind. You can't get a better reward than that, in my opinion. So that's why we do it, is seeing the good that comes out of it.
Well, I've heard you say several times in the past couple of years, and I quote, it's heartwarming to see a miracle happen.
Oh, it is.
And I've seen you get pretty choked up. You've told a couple of stories. We were with President Carter a couple of weeks ago, and I saw you try and stop a tear or two from coming down.
Well, you know, if you look at that film, and if it doesn't do something for you, then you don't have any feelings, you know. And it's those warm and fuzzies in your life that really make a difference. And, you know, there's nothing embarrassing or shameful about shedding a tear about people that are in need and you having an opportunity to help them.
Absolutely. And so, you know, that quote, it's heartwarming to see miracles happen. This partnership that we have is a miracle in itself. It's unique, very unique. And I understand Lions is coming up on their 100-year anniversary.
In 2017, we are going to be celebrating 100 years of service. We're very proud of what we've done. We're now in 208 countries and geographical areas around the world. With every Lions Club working under our We Serve motto to make their community and the world community a better, safer place to live. We've been very proud that President Carter has been a lion. We feel like that when he served as district governor and then chairman of the Council of Governors in Georgia, went to that international convention and saw people from different countries around the world and the work that's being done, we know without a doubt that it had a great influence on what he began and wanted to do here at the Carter Center. So
really
we're very
amazing.
proud of him as a lion, and he's been very supportive of us, and we're grateful for it.
It's really fantastic. You know, we talked about a bit of the challenges, and we talked about partnership, and I just want to mention, as we talk about miracles and the spread of the Lions, that our offices, our programs in Ethiopia, Mali, Niger, and Uganda are heavily influenced by the Lions in country. So not only do we have a partnership with you, but we have a partnership on the ground that's very active. Our engagement with the Lions, the Lions Club of Ethiopia has been at every single mass drug administration since 1999.
And they're very proud to be a part of it, and I mean, they're elated at what we're able to help them do, and they want to be a part of it. And I know that there's a lot of you in here that are members of other organizations, and we applaud you for the efforts that you're making, and because we know that you're making a difference in some way in someone's life. But we're very proud of those Lions, and we feel like that our organization Lions Clubs International are the world's greatest doers. We try to do what's right for the benefit of humankind.
Well, and I think that will lead beautifully into my last question. You're in this for the long haul, but why river blindness? Why trachoma? Why blinding trachoma? Why is Lions specific on that disease?
Well, in 1925, Helen Keller, who was both blind and deaf, came to our international convention, and she asked Lions to become Knights of the Blind in the crusade against darkness. And as we worked in our communities and collecting eyeglasses and doing surgeries and things throughout communities here in America and other parts of the world, and then when the WHO came to us and shared with us the need, we felt that it was the only thing that we should do, is that we should accept that responsibility and do all we could to help eliminate the backlog of preventable and reversible blindness. And we're going to be there with the Carter Center and other NGOs until we win that battle.
Well, it's great to do it with you.
Thank you.
And with that, we're going to ask the audience if they have any questions that they'd like to ask. Please feel free to use the microphones. There's microphones on either side of the stage or either side of the seating area. Please feel free to come right up.
Kelly, I think you can hear me.
Yes, ma'am.
I have a question. I'd like you to talk a little bit about the research you're doing on whether more intensive drug treatments might speed the end of the scourge.
Ambassador Marianne Peters just asked about a research project that we have formulated and are looking at starting in the Amhara region of Ethiopia. Dr. Paul Emerson is here tonight. You saw him in the video. He's the former director of the Carter Center's Trachoma Control Program and now is with the International Trachoma Initiative. And with his great stewardship, the Amhara region of Ethiopia has distributed an enormous amount of drug. However, we're still seeing that the infection rate is staying at a certain stagnant level. And we think that in these areas where the disease is really entrenched, we might need what I'm terming a silver bullet, if you will. So looking at targeted zithromax, use of the drug, 100% of the population, and then targeting children ages 1 to 9 the second week, and then targeting them again the third week. So quick succession and a sustained facial cleanliness and environmental improvement. We're looking at getting that off the ground in the very near future. And thank you for that plug. If anyone would like to donate, I'll be taking donations shortly after. We're really excited about this, and Dr. Emerson has graciously agreed to enter into this study with us. So we're looking forward to it. We think, and the theory is, this is theoretical. It's something that was hatched probably in my sleep, but theoretically, if we can get this done quicker, we have less suffering, and we use less drug. And we don't have to sustain the efforts. We can look at environmental improvement, facial cleanliness, water. We can look at other options and other things that are necessary once we stopped the infection and the transmission of the blinding trachoma or chlamydia trachomatis. So we're looking at it, and we hope to start it in the next couple of months. It's a really big study, and it's very exciting. Thank you for asking about it.
You talked about having a goal of elimination in 2020. Yeah. So do you have metrics around, what your baseline was and what's happening in terms of reduction and that kind of stuff? And are you able to share that, or will you be sharing that later in the program?
That's an excellent question. Thank you. We do have absolute baseline, and when we started, what we do is we carry out surveys to look at the prevalence of TF, trachoma follicular, in children ages 1 through 9, and then the population, and also TT, trachoma trichiasis, how many people in the population have at 1 to 5 eyelashes or more than 5 eyelashes touching the globe. So we look at all of this, and we have a baseline of when we started, and then we start doing the interventions, all 4 pillars of the SAFE strategy, and then we look at that after a certain number of years. So we have markers, and we have baselines. So we have quite a bit that we have been able to document and put into maps, and we can show colors, and red is good, red is bad, green is good, and we can see that over time, what has happened in each country where we work. And so far, in all of the countries where we started, we were in mostly red areas, and they're slowly moving into orange and some in green. So we are marking, and we can see progress.
I'm probably not the only one that's never heard of trachoma before, but I had a couple of technical questions. It seems like two main vectors are the bacterium and the flies. And in hearing articles about what DDT did with bed bugs and how many years, are there people doing research on the fly reduction process, or are there people doing research on the actual bacteria? We know the Dithramax, I guess, works on that bacteria, but are there also sources of that bacteria? Is it in the ground? I just don't know.
That's an excellent question. We're carrying out studies with the University of California, San Francisco, the Proctor Foundation. We've done quite a few studies with them over time that Dr. Emerson had initiated. And we've looked at infection rates. We've looked at different aspects of the follicle in the eye. We've also looked specifically at targeting what's called WASH interventions, water, sanitation, and hygiene specifically. And also we've done studies with Emory University. There's lots of different intervention studies that are being done. And also looking at infection rates. There's been studies on how can we look at the face to see the discharge on the eyes and the nose and then count the flies, putting in community latrines and household latrines. Does the fly population go down? So there is quite a bit that's been done over time to help us formulate moving forward. The Carter Center has a program review every year. We bring together all of our partners in our countries annually. We are data-driven and outcome-oriented. So we look at the data. We sit down in this room and we put the data on this big screen and we talk about it. We also talk about what has worked and what has not worked. And we've done this for 15 years. So we have proceedings that are about this thick for the past 15 years. So this year, we actually looked back. We went through all the studies that have been done, what worked, what did not work, what needs to be changed. So we called that program review Looking Back, Moving Forward, and took what was already done. We don't have to reinvent the wheel. And what can we do? How can we use that information to move this program forward in a faster way? We only have 5 years. So sort of a long answer to your question, but thank you.
You spoke of trying to recruit new interest in your programs, your health programs, your peace programs. I recently discovered the Junior Philanthropist Program through the Carter Center, and I've sponsored one of my students. And I'm wondering what the Lions Club does to generate interest in the youth.
Well, we have several youth programs. We have our LEO program, which is for the younger young adults in Europe and in Latin America. And then here in the United States, the age are for high school students that are members of the LEO Club. And then we have a program that we call the Lions Quest program, which is a life skills program. And that is right now in about 35 different countries where we're trying to help the young people to grow into productive adults, to avoid drugs and alcohol and violence prevention. So we're very big with helping our youth.
Jim, I understand your 13-year-old grandson, Dylan, is going to go to an annual meeting in Honolulu. So
he's going to be excited. I told him he had to wear some glasses that he couldn't see through.
But this is part of that. You're not just generating. Well, we won't talk about that.
He'll have an opportunity to meet young people his age from all over the world, and in the meetings that we have at the International Convention, and he will see firsthand and listen to them of what they do in their communities to make life better.
So this is, at that age, you're not just instilling this in children across the Americas, but in America, you're doing it with your own grandson.
Oh yeah, all over the world, and with our grandson, we try to keep them involved to see the value. You know, I think all of us need to be providing some community service in some way, and the sooner we teach our young people how important it is, the better it's going to be for all of us, because, you know, it's real important. You can think about the young people. They don't make up 100% of our population, but they make up 100% of our future. They don't care how much we know till they know how much we care. Pure and simple.
Very wise words.
Yeah. I think we all know that in Latin America, Africa, Asian countries, that there's a really big problem of lack of potable water. And this is a concern that many of us have. We're Rotarians, and we are bringing in freshwater wells for the Maya because the government and the hospitals will never take care of them. And just one couple of figures. The average lifespan of Mexican in Mexico is about 78 years. The Maya, the government or hospitals will never take care of them. Lifespan is 40 years. Infant mortality rate for the Mexican is about 6 per 1,000, and for the Maya is 168 per 1,000. When they drink water, it's portable water. And I have a suspicion, even though they're washing their faces and this and that the water they're getting, if they're bringing in from the countryside and so forth, is not potable. And this is what brings about deaths of children and also adults. So what is the Carter Center doing in terms of bringing in potable water?
It's a really good question. The Carter Center's flagship program is the Guinea worm eradication program, and it's sort of where I got my legs. In the past 19 years, I started with Guinea worm eradication, and that's always been the big question. What are we doing about potable water? And the problem is that it's so expensive and it's so challenging, and all of our resources would go specifically only to water. We advocate for water sources. We work with governments, with ministries of health. We work with other partners to advocate for water. We provide filters in the guinea worm program to filter water, but we can't do it everywhere, so we focus on our niche of elimination, eradication, and control, and we advocate. We give specific line listings. We, again, are data-driven. We have line listings of every location where we're working, and where is water, where water isn't. If there is water, does it need to be rehabilitated or repaired? And we provide those line listings to the Ministry of Health, to the ministries in the country, and to other partners as well, and try to advocate for something to be done in that particular area. It's a very, very challenging question, a challenging topic as well. With finite resources, what do you focus on? And unfortunately, water is extremely expensive, so the Carter Center chooses to focus on those diseases that are affecting the poorest of the poor, and trying to help eliminate those as quickly as possible.
I was very much moved by the clips that I have seen, and recently we just came from Kurdistan, from the refugee camps, and I've been seeing all of the flies on the children's eyes, and those people, they've been displaced, and their condition is very, very tough. So I'm wondering if the Lion Club or the Carter Center has done anything in this part of the world, and if not, we're willing to cooperate with you, since we work very closely with the Kurdistan government.
Well, I'm not sure exactly. I know that there's been some movement from some of our line members in England, but we would be very happy to talk with you and sit down and see what we could do together.
Fantastic. Thank you.
Yes.
We have time for one last question.
My name is Jordan Ryan. I'm the new Vice President for Peace Programs here at the Carter Center. So
welcome
this
to the
is
Carter Center.
my first opportunity to hear a presentation, and I just want to really congratulate both, obviously, the Carter Center, but the Lions Club and your personal involvement started a long time ago. And I think the partnerships that you've spoken of are so important. But you had intimated that one of the real difficulties that you face is in the war-torn countries. Mali now is fighting, South Sudan, obviously, where you've worked personally for a long time, and spills over into places like Ethiopia. What have you seen as, both of your, since being able to talk to presidents and others, of that link between the need for peace and obviously the most important thing of health, especially for those most vulnerable, and how is it impacted on the work of the Lions Club and the Carter Center? Is it just able to do nothing, or can you get around it? Or so that discussion a little bit on the link, but also the ability to work on that. And I think the final point that you made is on the engagement of the government being so absolutely important, especially the village chiefs and the tribal leaders can make such a difference if they get behind it. Do you have programs where colleagues, say, in Ethiopia are going to Ghana or to Mali to do sort of bringing either lions together or workers from the field together to really share that kind of experience of what they've done locally that can make a difference in terms of the spreading of knowledge? Thank you.
Absolutely. We have, we have what's called an All-African Conference, of which many of our line members are part of, and they go from country to country and helping to make certain that these programs are working effectively. But what happens when you ask about the government? As Lions, we'd never give any money to any of the governments. It's always gone to some other NGO or either to the Lions to do the work and to monitor and to make sure that everything is kept in perspective. But what happens in many parts of the world is that you'll have a government and you'll be working with them, and all of a sudden they get voted out of power and the other governments don't want to do anything. So there's always that challenge, whether it's as Lions or the Carter Center, but it's a problem sometimes.
I'd like to welcome you to the Carter Center and say congratulations. I'm thrilled that you're here tonight. Thank you for coming. I think the Carter Center is unique in that we're community-based, and we work directly with the communities and where we're working. And we truly believe that health is a bridge to peace. And it's evident. You know, President Carter brokered the Sudan, the ceasefire, the Guinea worm ceasefire that gained us entry and started an entire program in a country that was incredibly war-torn at the time. I was fortunate enough to work there for 5.5 years and experienced major challenges. However, the program being based in the community made it sustainable. So despite the fact that we might have had changes taking place and there might be someone else in that environment, the community-based organizational structures that the Carter Center works with, whether it's guinea worm or blinding trachoma or river blindness, can pretty well overcome some of those issues. We're thick-skinned and we're not risk-adverse. There are places where the poorest of the poor are suffering from diseases that need to be eradicated or eliminated, and we go where we need to. We also rely on the expertise and the amazing communication of the chiefs and the village police and the elders and people that live there. And we have very strong, open lines of communication with them so that they can help us and tell us where to go and when not to go. And that's the essence of community-based. So it's, despite the fact that there are huge challenges and we have limited access at times, we try and take the access when we can and improve the quality of people's lives, gain trust, build that bridge using health, and building trust with the community so that they'll continue to work on things when we can't potentially be there. So I'd like to thank all of you for coming. That's all the time we have tonight. Jim, I'd like to express my deepest gratitude. You just really have been phenomenal, and I'm so pleased that you were here and able to share so many amazing stories and really focus on the essence of partnership. I can't thank each and every one of you enough for your support and commitment to our work together. I think Jim really extolled the virtues of partnership and also you as individuals and what you can do and what you have done. I hope you've enjoyed the program and have firsthand seen how your support helps stop needless suffering from preventable and debilitating diseases. Thank you very much for joining us this evening. We look forward to having those of us here in the audience join Ambassador Circle's events tomorrow. Good night, and please remember to tune in this fall for our next series of conversations. Thank you all again.